Find out what's on the front page this morning, and I'm joined by Chelsea Daniels, your host, and you're looking at the broken health system today.
Yeah, something that you know a lot about, hey Mike. So I spoke to Association of Salaried Medical Specialists Executive Director Sarah Dalton, basically just chatting about why they're obviously on strike until midnight tonight. They went on strike yesterday. This is the senior doctors and dentists. Basically about, you know, what is a senior doctor for starters. I mean, we see all these people on strike all the time. What do they want? What are they saying? Why are they on strike? Who's affected? So we really dove into the situation in the health system at the moment. We spoke about Health New Zealand actually spends upwards of $200 million annually on locums rather than pumping that back into salaried medical specialists. And she said, you know, why would you prioritise letting locum rates go up and up and up for temporary labour, who of course they do a good job, and why wouldn't you go and do locum work if you're going to get paid more? But they don't do the whole job. They're not there for the long haul. And, you know, the Health New Zealand keeps saying, well, no, we're not going to pay you a retention allowance for working in Gisborne or Invercargill or something. So she said, well, there are definite ways that we can fix it now, but of course the health system, there's no quick fix, there's no silver bullet. She said, so far negotiations have been empty, and the only time an offer has been brought to the table is when they've called for strike action. She said it's like kindergarten level stuff at the moment. Right. And she said, look, some of the conversations that they're having behind the scenes as well, you know, oh, we can't give you this or else the nurses will want it. You know, we can't give you this allowance because then, you know, another group will get upset and they'll want it as well. It's like, yeah, pay everyone better and give them better allowances.
Well, yeah, that's exactly right. And I think, you know, we had the Prime Minister on, we've had Simeon Brown, and we've had the Health New Zealand all kind of chiming in and saying, well, look, what the doctors are doing is not fair. It's putting procedures and appointments at risk. But then again, I mean, you've got to say, and I'm sure Sarah Dalton would agree, that senior doctors don't just do this on a whim. They don't walk out of their office and flag their duties.
No, exactly.
For
and well, that's actually
this is a problem, right?
Funny you say that, because I've got a clip for you. Sarah said that they genuinely don't like doing this. Take a look.
It's really hard for them to take strike action because they are trained to put patients first. They are trained not to walk away from people who need care. But it has reached the point now that the health system is actually on a daily basis preventing them from giving people the care they need. I guess the term that academics use for this is moral injury, the injury that you suffer when you're actually prevented from doing the work that you're trained to do in the way. And so our members spend a lot of time trying to do the least worst thing for patients rather than the best thing.
And I guess, Chelsea, just picking up on what Sarah was saying there, when you have not enough staff, too many patients, the real issue is patient safety, and we're already seeing that emerging at Christchurch's ED. We know that people are treated regularly in corridors at Middlemore's ED. Is that the core issue here? Safety of patients.
Yeah, I mean, and you heard it from Sarah as well. They're choosing not the best route of care. They're choosing what's best for right now, basically. And is that a health system that we want and that we're investing in as Kiwis as well? Our tax dollars are going towards this. And I said to Sarah, look, stop anyone on the street and ask them, what would you prefer your tax dollars go to? Probably health and education, wouldn't you say?
Yeah, absolutely. I think the public are behind the doctors and nurses, to be quite frank. Hey, Chelsea Daniels, great episode. Looking forward to it. Chelsea Daniels, the Front Page podcast host. Available wherever you get your podcasts. Right, well, next, Katie Oliver with...